I'm Lara Land, somatic coach and yoga teacher trainer, and this is the Beyond Trauma podcast. What a couple of years we have had. The challenges continue to grow, and more of us are experiencing some level of traumatic stress. My commitment here is to bring you the most up-to-date insights on exactly how trauma affects our mind, body, spirit system, and how we can work with our bodies to soften its impacts. You will be hearing from trauma survivors and researchers, and together, we are going to incorporate what they have to teach us to heal ourselves and promote the well-being of all those around us. Here we go. It's out! The Essential Guide to Trauma-Sensitive Yoga is now available everywhere books are sold. This is the book for every yoga teacher, studio, and practitioner who wants to incorporate an inclusive practice to yoga. It's available on my website, laraland.us, and everywhere books are sold. If you're loving this podcast, you are going to love this book. Well, those of you who have been following me on the Instagram know that I have a passion for cold water plunge and have recently taken that passion to cold water swimming to raise money for the nonprofit 3.5 Acres Yoga and also to challenge myself. And a lot of that challenge was because of learning about our guest today. Our guest today is Dr. Mark Harper, a consultant anesthetist whose clinical work is split between Brighton, England, and Norway. His first field study of research was investigating the way to keep patients warm during surgery and thereby reduce the incidence of post-operative complications. And the results of these studies have been incorporated into national and international guidelines. Mark was invited to be an expert clinical advisor to NICE, the National Institute Health and Care Excellence, shortly after taking up his consultant post in Brighton in 2023. He started swimming in the sea throughout the year. Around the same time, while working on his PhD, he brought together his clinical research and the physiology of cold water adaptation to show how outdoor swimming could be employed to reduce surgical complications. Further insights, both from his personal experience and the experimental literature, led him to propose that cold water swimming might be an effective intervention for mental health problems. And in collaboration with Dr. Chris Van Tolken and the Extreme Environmentalist Lab in Portsmouth, he had the opportunity to test this in practice on the BAFTA award-nominated BBC television program, The Doctor Who Gave Up Drugs. Following this success, he set up and ran the first ever clinical trial using sea swimming as clinical treatment for anxiety and depression, the outcomes from which were incredibly positive. In the process, he helped set up Chill UK, which now provides outdoor swimming courses for hundreds of people around the UK. He is featured a number of times on national television in the UK, as well as making many appearances on radio podcasts and national newspapers and magazines in countries as far apart as US, Canada, Germany, and New Zealand. In March 2023, Mark gave a presentation at the Scottish Parliament on how and why outdoor swimming should be adopted as a public health measure. He's a member of the All-Party Parliamentary Group on Outdoor Swimming, and his book, Chill, the Cold Water Swim Cure, was published in 2022. As a doctor, researcher, writer, and participant, he is uniquely qualified to provide a comprehensible, and holistic perspective on the practice, physiology, and health benefits of cold water. And boy, does he cover a lot in this episode. We discuss why cold water can be good for trauma, for chronic pain, maybe even for dementia. We cover how long you should cold plunge for and how often you need to get in the water, and the many health benefits and why we think these health benefits happen. I share my own experiences, and Mark shares anecdotes from many of the people that he has been with in cold water swimming experiences. Many have been helped to recover from serious illnesses, mental health issues, and physical health, and so forth. This is an exciting episode, everyone. And if you think you can't get in cold water, if you think you can't cold plunge or cold swim, I understand. I was you, and we're here to tell you you can. So take a listen on our recommendations, how and why you want to take the plunge and enter cold water swimming. Here we go. All right, Mark, Dr. Mark Harper, I am so glad to have you here. Again, thank you very much for making time. It's pretty late where you are, right?
Yeah, it's getting late. It's not dreadful, 8 o'clock in the evening, but I like to go to bed early, so get up for my cold water swim tomorrow morning.
All right, there we go. That's what we have to talk about. Well, I'm an early to bed. By 8 o'clock, I'm definitely starting to doze. And yeah, I don't quite do my cold water morning swim yet, but a little yoga meditation and all that stuff. So pretty early bird too. And I am just so excited to talk to you. My background is yoga and trauma sensitivity. And that's, the kind of the core of my practice. And I train yoga teachers in trauma sensitivity. But I've definitely been adding different modalities into my life and sharing them with others and testing them out. And cold plunge has just been huge for me. And if you would have asked me, I would have been like, no, like, no, I'm not. No. And I know when I film little things of me doing cold plunge. I recently did a fundraiser and you inspired me for my first time in natural free flowing water. So before that, I had always been in the tub, and people say the same thing. They're like, no, I could never do that. But I started slow and I've worked my way up, and it has helped me during some tough times.
Yeah, I mean, I think this is the experience most people get. Exactly your experience, which is no, I'm never going to do that, and then they do it, and that's all right, and that then they find it really does help through tough times. It seems incredible. I mean, to me, sort of diving straight in, as it were, the thing that I have seen that most captures what my own experience is, and really links in with the feedback we've got from various courses, various clinical trials we've done, is something explained by Jill Bolt Taylor. Jill Bolt Taylor. Who have you come across her thing, A Stroke of Insight?
Oh, of course. And you mentioned her in your book as well.
Yeah, exactly. And so it's going into cold water is just a complete reset. I realised this reset. I've seen it and I've mentioned it in the book as well. I go in and your brain's all full of chatter and stuff. And then you come out and the world's just like a completely different place. It's a calmer place. All that chatter is gone. And what she described, when she was having her stroke, was because that was completely blocking off the left side of her brain, which is where all that chatter goes on, she actually felt really calm and euphoric. And it was just the right hand side of the brain, which is empathy, it's being in the moment, it's all that kind of thing. She didn't mind the experience of having a stroke. And that's what I get as well. I come out of the water and all that chatter's gone.
Mm. Yeah, for me, it's the stress that lives in my body. I don't suffer so much with the mental rumination, but I hold everything in my body. And this past year, the second half of 2023 was very stressful. I had a loss, and I knew instinctively that going in the cold water was really going to help me get at some residual holding that I just couldn't get rid of.
Yeah, and I think again that's it's so interesting. Were you cold water swimming before then?
So I was. A very dear friend of mine at Steady Slope has a women's night with sauna and cold plunge. We're definitely going to dig into the difference, because I know you're into, really, your thing is being out in the real water. So I'm curious about that. But she has the tub. And so I started with, I love the sauna. I love being warm. And I started with the sauna, and then I would go in very slowly into this tub. And, just over time, I got more used to it. And I've been able to go in more fully. I've been able to stay in longer. I even wiggle so it does stay cold. And I hadn't done in a while. Actually, I had been pregnant, and so strange. I want to ask you about this as well, because I didn't know I was pregnant, but I had gone to one of those sauna nights, and I instinctively just felt super weird, both in the hot and in the cold. It was like, I had never had a reaction like that. So then I had stopped doing it. Unfortunately, that was a loss. And then the thing that really helped me get over the hump of that loss was going back in that water.
Yeah, so it's interesting you say that you sort of just instinctively felt that cold water was the thing. Yeah, one of them was a friend of mine in Norway. She suffers from, I write about in the book, Solveig. She suffers from bipolar disorder. And, one day she hadn't really cold water swum. She might have heard a bit about it from me. I mean, anyone that comes near me hears about it, really. But then she just walking past, going for a walk one day, saw the cold water, said, that's what I need to do. I just need to get into that cold water. And I still hear from her. She still sort of occasionally sends me things. Oh, this is so great! Really enjoying it, and still really helping. After years of doing it now, so which is great to hear. And so it's quite interesting to hear that you were saying, "Oh, that's just what I need."
I knew, there's doing the yoga, doing the talk therapy, doing the rate, but like there was a point that I'm like, there's just something left in there, and I knew that, when I do that cold water swim, it's just, it's a full release and a really peaceful, euphoric state. And we do go in this hub outside, and often can see the stars, and I just feel truly at peace. Now, I am curious. So, like I said before, when I started, it was very scary getting in the cold water. And I think a lot of people go through this. I felt like I couldn't breathe, and I don't like that feeling. Like I'm definitely that person that's really scared of that tightening of the breath. And now it's almost like I have to work hard to get that feeling, which if I understand right, and I want to ask you, it's important to have that stress response and recover from that. Is that true?
Yes, that's it. And so what you're describing is perfectly is the physiological adaptation to cold. So when you first get in, when you're not adapted to that cold, you do get this sharp intake of breath. You cannot control your breathing. And this is why people die out in the ocean or whatever. It's not because their heart rate goes up and they have a heart attack or whatever. It's because their head goes under the water and they can't control their breathing and they just breathe in water. So that's why it's really important to start slowly. And so what you're describing is perfectly is the adaptation. So the studies are generally around 15 degrees centigrade. So what's that? 58 Fahrenheit, something like that. And you go in for 6 times and just for a few minutes at a time. And what they show is that with that kind of input, that kind of exposure, that breathing comes under control. And this isn't you do get a diminishing of the stress response, but that isn't part of it. That's just adapting to the cold. That's not kind of part of the stress response we're looking at. But the other thing is, you do want that stress response. You've got it quite right that the exposure to the stress is really good for us. But what we don't want is for that stress response to go into what I call the pathological or bad zone. What you want to do is keep it in the physiological or good zone because we need stress. It's great, and exposing ourselves to stress. That's how we grow stronger. If you go to the gym, the reason you get stronger is by micro tears in your muscles, stressing the muscles. And it's the same. You go into you're in another type of stressful situation, and this is I don't know. It's cold stress, but they're all kind of related. And by getting used to that stress response, you're dealing with stress in the rest of your life through a process called cross-adaptation better than you were before. So you don't need to worry that you can't get your breath. That's absolutely fine. What it's showing is, one, your body's adapted in a safe way. So if you ended up in the ocean unexpected, you'd be much safer. And two, it's just showing that you are keeping your stress response in a good place rather than letting it loose into a bad place.
Okay, that's good to know, because I was wondering if I have to keep going colder and colder and longer, and it is a little bit addictive.
Yeah, and that's another really important point you bring up. Colder and colder and longer and longer. You do not get any further benefit. If you look at the studies of cold adaptation, there really appears to be no benefit or no increased adaptation below 10 degrees centigrade. So I don't know, what's that, 45, 50?
Okay.
You know, and the ideal zone really is probably about 10 to 15, but even anything below 20 or 68 Fahrenheit, that is, evokes a really strong physiological response in the body, and you get adaptation at that level. So it just doesn't have to be that cold.
That's
And the other
great.
and the other thing is, it doesn't have to be that long either, because most of the effect that you're getting comes within the first 2 or 3 minutes. And you probably know this from your own experience, that when you go into that water, I certainly get this still after 20 years after doing it. When I go in initially, I still have that, I sort of kind of tense up, I guess. It's like, oh, this is really, really hard.
Mm-hmm.
Um, but then 2, 3 minutes later, even in the coldest weather, that's all passed.
Mm-hmm.
The term I use is I've recombobulated, and
Yeah.
and so you recombobulate. Then you can look around, you can look at the stars, and you can take them in. By that point, you've done as much as you really need to do. You might get a bit more by being out a bit longer. I mean, of course, it depends on the absolute temperature of the water, but staying in longer and longer. The problem with that is that you start to become hypothermic, and hypothermia is always bad for you. I mean, my PhD and whatever is in stopping people getting cold during operations. As the anesthesiologist, that's something we can do to reduce their stress response.
And that was like amazing to me. So you discovered that cold plunge, people who are preparing for surgery, and in surgery, the body becomes hypothermic, right? Tell me if I'm saying this wrong. And that's why you get those warm blankets on you. You discovered that people could actually train for surgery.
Yeah, well, I mean, I haven't quite done the experiment, but I think I've got a very good theoretical basis. So I proposed the hypothesis that you could train people for surgery by taking them cold water swimming, because what you get when you become cold during surgery. Yeah, so you're quite right. The body becomes hypothermic; it loses its temperature control during an operation. Yeah, when you have an anaesthetic. So really important to keep warm, and the colder you get, the greater that stress response is, and the greater that stress response, and again hitting the pathological zone, the bad zone, not in the good physiological zone, the more complications you get out of surgery. So getting cold is something that you really want to avoid. I mean, again, it's like you go use the gym analogy. You go to the gym, get those micro tears in your muscle. That's what makes it grow back stronger. And that's what we're aiming to get from cold water swimming. Whereas if you overdo it in the gym and you injure yourself, well, that sets you back. And it's the same. Hypothermia is that kind of injury to the body in terms of cold. So you don't want to become hypothermic. And then, so you may get a little bit more benefit if you stay in a little longer, but then you start running the risk of becoming hypothermic. And as I said, that's kind of injuring yourself.
Well, that's so important, right? Not to overdo things and to understand what that zone is. And I always think that as well, like medicine and poison are somewhat related, right? And it's often about dosage.
Oh, it's completely. I mean, Paracelsus said that in the 16th century. That it's everything's a poison. It's just a question of the dose. I mean, oxygen's a poison. Yeah, I mean, I don't know if you know, Stevie Wonder is blind because at birth he was exposed to 100% oxygen.
Oh, I didn't know that.
Yeah, and this is it. So 100% oxygen, causes in babies causes them to go blind. Yeah. And actually, we don't use it, or we shouldn't be using it during an anaesthetic, except under extreme circumstances, because again, you get more complications with 100% oxygen.
Yeah, so, no, this is a great warning. Sorry, Mark, go on.
Yeah, no, I mean, just to say, so you're right. It's everything's a poison. It's in the correct dose, but with a little bit, it can be very good. Obviously, we do really want at least 21% oxygen.
Now, when we go, I started in the tub, like I mentioned, and I just recently took my first cold plunge out in the and a lake. I was very nervous, but I felt more confident because I had read your book. So I had my husband with me. I went to the site beforehand, and I knew the site from the summer, but I went again. I checked it out again, and then I brought my husband with me because being out in the free water is a little bit different than being in a tub.
Yeah, exactly. I think there are a few aspects to that. You mentioned the fact that you're a bit nervous about it, and that's good. What you're doing there is you're overcoming a challenge. Again, this is one of the feedbacks we constantly get. People that feel really proud of themselves. They've overcome this challenge of, one is the cold, and two is a lot of people have a lot of fears about the open water.
Mm-hmm.
So overcoming that challenge is a big part of the positive effect of it, I think. And again, you describe you're doing all the right things. You're checking out the area. You know how you can get out. You know you're doing it with someone else, so you can, so you're safe or someone around there. And this all helps. And I think for me, going out and doing it in open water, what you're getting there is first you're getting nature therapy. It's green therapy. We know that being out in nature is good for you. Blue therapy.
Mm.
We know that people with, for example, with views of the ocean have, or any water actually, have better health. And also, it's something that keeps you going back. And I think this is one of the key things to the success of our studies on depression and depression and anxiety is that people keep going back because it's just such a nice experience being out there. It's a whole package. Cold water swimming, particularly outside, is something that brings a whole package of benefits together. And the community as well is massively important. And although these things do have some beneficial effects in themselves, I also think it's really important. It means it's something you want to keep doing because it's just a fun thing. You don't want to let your friends down, and the whole experience is so enjoyable.
Yeah, I love that. I love that you talk about the community aspect. And I think my Monday nights with the ladies, like doing our cold plunge together, has that, and there's something very special about that. And I love what you're saying about blue spaces. I took forest therapy certification. We talk a lot about green, even the studies around having a green, like even in a hospital room, if you had a picture of trees or green landscape. So I wasn't aware until your book that blue landscapes, ocean views also have such an impact on the system.
Yeah, it's interesting. I think what people like about blue spaces as well. I mean, don't get me wrong. I think forest therapy, all that. I mean, it's fantastic. It's really, really important, really beneficial. I think what you get those what are they called, phytokines or something. The
Yeah.
from the forest. There's another aspect to that, but you get a separate effect from the blue therapy, and it's particularly people like constantly changing environment. And you talk about you mentioned the having the pictures in the hospital or of outdoor space. And what people have found with these studies is that if it's a constantly moving space, then that creates an even better effect. And that's, just having the pictures or the TV screen, that's good. But having something that's constantly moving and constantly changing, that's
Mm.
even better. I tried to get, it didn't quite work, bureaucracy. But what I tried to do is we've got these high dependency intensive care units, which are just bunkers. They're in the cellar. They've got no light. Or no natural light. They've got no windows. And what I tried to do is get a webcam put on top of the hospital. The hospital I
Oh,
work at
brilliant.
is with a view over the ocean. And so to have this constantly changing thing, and then you see night come and day, night come
Oh,
and go, and day come and go, and then you would have a dynamic view. And I'm sure this would help with. The plan was that it reduced the instance of delirium and stuff like that. Eventually, we did get a few screens and pictures, and so we got something out of it. But I would love to have had that. I think people would love it.
oh
It
my gosh, they would
orientates
love
them,
it.
and just as you say, even the view of nature has been shown to have beneficial effects.
Yeah. Well, don't stop. I really connected with that, what you just said. My father, some years ago, was in the hospital for 3 weeks in ICU, and it was very on the edge. He was in a doctor induced coma. And when he came out, he had the delirium, and they actually didn't know if it was going to go away. It was super scary. And the nurse told us to just like help him to connect with his senses. But living in the hospital for, the month, and wow, people can really use that.
Yeah, I mean, you have so little other sensory input. I mean, the sounds in a hospital, let alone an intensive care unit where it's even worse, are just sort of really weird. They're pretty constant. You can't really work out what's going on from the sounds. The sensory input, I mean, your brain, the comas that you put in, the drugs that you get totally mess with your circadian rhythms. So maybe just having that visual cue would be a
Mhm.
massive help.
Yeah. It's amazing how we kind of, many of us don't even realize how, like, it takes such an extreme situation like that to realize how important nature, a view of nature, being in nature is, right? It's like, from that, we can kind of deduce that maybe on the day to day basis, we should be going out. Like, this is kind of an important element of our lives.
Yeah, totally. And I think we kind of forget it's like with all these things, with stresses, with any kind of stress, we don't sort of realize it's happening. As you say, you hold it in your body and it builds up in your body, but you kind of don't notice it until it's not there, until you get rid of it. And say you do yoga, I guess you do breathing techniques as well. And I just, having read James Nestor's book on
Hmm.
rest, yeah, I had no doubt you knew who he was.
Did you get the mouth tape?
So I do use that sometimes. It's quite interesting. Not always, but I do find it really interesting the effect it has. But more what I got from more long term effect from that was just that little app that he did with Moby doing the music, where or the sound is not really music, is it? And the app attached to it, where you do it's simple, it's 6 in, 6 out, or whatever, you can adjust it. And I find doing that, I think I'm all right. I'm busy, I'm working, got my usual day at work. I do that 6 minutes of I mean, that's the simplest breathing exercise you can do, really. And it just totally transforms me. I think of it as parasympathetic breathing.
Hmm.
It just gets the parasympathetic system working. And, it's only then I thought, God, I was really frazzled 6 minutes ago.
Right, right.
And I think that really, these small things really help. It's the same with nature. You don't realize you need it, but then you go out and you have a go. You go out in nature and you feel so much better. And you think, yeah, that's great.
So our body we get used to the feeling of stress where, we don't really notice it anymore. It becomes the norm. And then when you have one of those experiences that really kicks in the parasympathetic and you realize that you could be living with less stress, you're like, oh, this is what it means to be relaxed.
Yeah, and that's what you're getting. What we're doing with cold adaptation is, to reduce levels of stress. You can do two things. Either you can reduce the sympathetic input, or you can increase the parasympathetic input. And the sympathetic input, that's the adaptation to cold water. That's that reduction, that keeping your breath your breath breathing under control when you go into cold water. It's your heart rate and your blood pressure doesn't go up as much when you go into the cold. That's the reduction you see, and you see that overall as your baseline during the day goes down as you adapt to cold water. And you also increase the parasympathetic thing by when you put your face in cold water, the diving reflex that you see in babies, which is why you can put them in the water and throw them into the water. They hold their breath. It has this direct anti-inflammatory effect via the vagus nerve. So it's you're getting all this from the cold water swimming. Yeah, absolutely. Yeah, I do yoga as well. I love the breathing, but I think you get it really is another part of your toolkit
Yeah.
doing all this kind of thing to get into the cold water.
Yeah, let's talk about, what it does scientifically a little more, because the podcast is based on easing the impacts of trauma. You talk a lot about, the scientific benefits in your book. A lot of folks who have had trauma in their lives have a lot of physical issues later in life, unexplained pain, inflammation. Tell us a little bit about what is happening with the cold water swimming and how it can help.
Well, I think I'm coming round to the view that there's a couple of things with trauma. You have this massively sensitive cold water, massively sensitive stress response, and the stress response is actually basically underlies everything. It's our interpretation of it which is changed. I don't mean to demean it in any way at all, but if you think about it, a stress response can be this sympathetic thing. It can be that you are really excited about something. This is brilliant. I love this. You're excited to go to a concert or do something really exciting, and that's overlaid in your head as something really positive. I'm going into cold water. You or I now really excited about getting into cold water. Whereas for other people, it's a highly stressful and an emotional thing that they just can't imagine doing. So what you're doing is partly dealing with that stress response, and as you say, the body really holds that as well. But it's the more I've done about this, the more I think Descartes has a lot to answer for. The body and the mind just aren't connected. Just are connected. They're just not separate entities, and you cannot take them apart. So what you are getting a physical effect with the body, and you can separate it out. So essentially, with adaptation, what you're doing, as I said, is you're reducing your sympathetic, you're increasing your parasympathetic. So when you first go into cold water without being adapted, you lose control of your breathing. You get control of your breathing with adaptation. Your heart rate and blood pressure go up, but with adaptation, that goes down. And you also see other things like it improves the immune system. It reduces inflammation. So again, you go into cold water initially unadapted, and you see rises in cortisol. You see increase in insulin resistance, which certainly in surgery is an independent marker of complications. So the way your body handles glucose in your circulation, and all these stress responses are reduced by cold water swimming. And then you also get the mental effects, which haven't been shown, but that left to right shift, I'm so sure is what is going on. And then all these packages come together and reduce that stress response and take you out of the traumatic part of your life. And again, in the book I write about Rachel, who started up mental health swims, which is just huge. Thousands of people going every week as a result of her determination from one swim that she had. And, she describes a history of a lot of trauma as a young woman, which she really finds that she can help with. It doesn't go away completely. It's not a cure, but it massively improves the way people can handle things. And what we usually find is people aren't cured of their stress, their trauma, whatever, but it takes them from a level where it's really affecting their lives down to a level where they can function pretty normally.
It's just incredible. It's so interesting how this adaptation to the stress response that's happening in the water is then generalizing into life.
Yeah, and this is it, and we see it and we hear it from people. There's one study that they did do which showed a physiological. They say this is cross adaptation. So what we want is for we're adapting to stress, and in this case we're adapting to cold water stress. But what we want is that some way of showing that adapting to cold water stress allows you to adapt to other stresses in life. And a great study done by a group in Portsmouth who we collaborated with, as part of the group who's doing all this research a few years ago, was they took people and put them in a low oxygen environment and make them do a test on a bicycle, a static bicycle. Then half of them went through a cold water adaptation program, half of them didn't. They came back, they did this test in this, I think it was 16% oxygen environment. And what they found is that those who had done the cold adaptation performed better than those who hadn't. So exercising in a low oxygen environment, that is a stress. So what they were showing is that adaptation to one stress translates to adaptation to another stress. And this makes sense because we're not going to have a different cold response to cold stress, to being late for the bus or whatever, for being chased through the jungle by a lion. I don't know. We're not going to develop different stress responses. The body is a very elegant system for dealing with these things. So it makes sense that you get this cross adaptation, and that's why I think we see that it has an effect on other parts of people's lives.
Yeah, that makes sense. The body reads stress. It's not necessary, to know what is the stress about. It's reading stress, and it has learned how to bring the body down, how to kind of click in that parasympathetic and kind of slow the body down when it comes across that stress.
Yeah, exactly so.
I love that. And there's some other, I mean, in your book, you mentioned quite a lot of, I don't want to say illnesses, but, it's quite far reaching how many things we think cold plunging, cold water swimming could help with. I wrote down a few. One thing that stuck out to me, and I know you said the studies aren't super clear yet, but dementia?
So dementia is a tricky one. I think we're never ever going to be able to do the study which clearly shows this. But it was a really nice study. So it's very basic science. And, you can't read anything into this. Well, you can read something into it, but you can't read anything definitive into it because you're never going to be able to do a whole life and see what happens with dementia. But it's a lovely study. So what they did is you have this thing called cold shock protein, and it's what you see in hibernating animals.
Okay.
And what happens in hibernating animals during the winter, one of the ways they adapt while they hibernate is they reduce the number of connections between the neurons in their brains. And so essentially their brain not only slows down, but all these connections go down as well. What I find is, and then this cold shock protein will help them regenerate at the end of winter. So what you also see in dementia is that you get reduced connections between the nerves in your brains. It's all about the connections rather than the actual number of nerve cells. It's all about the connections. You see that as well. So the hypothesis of this group is that that cold shock protein might have a way of reducing dementia, or people with high levels of cold shock protein have a reduced risk of dementia. So it was a good theoretical basis. And what they did is they took a group of cold swimmers in an outdoor swimming pool in London. And I love their control group were a load of people who did Tai Chi on the side of the pool at exactly the same time that these guys were doing their cold swimming. And what they found is that in the cold swimmers, there was an increased level of cold shock protein in their blood. So that means that cold water swimming, increased cold shock protein, potentially reduced risk of dementia.
I mean, that's enough for me to do it. That's I think for many of us, a big fear. And even if we're not sure, there's some chance that could be preventative for dementia. I'm getting back in the cold water.
Yeah, I mean, I think there is a chance. It could be maybe what you should be doing is doing your Tai Chi first, and then going and getting a cold swim afterwards.
Do my Tai Chi, my cold swim, my crossword puzzles.
Yeah, exactly so.
Exactly. I mean, it does become sometimes like there's so much we need to do, but I'm a fan of cold water swimming as it's really becoming more and more of my toward my number one. I mean, all these things. Tell us about, maybe cold water swimming against depression or any of the other, you have so many great stories in your book. Any studies or stories that stick out for you?
So I think it comes down to what we had initially. Yeah, so we thought, you see, there's so many conditions. And so I think, well, we can't do studies on all of them. I'll come and talk about a bit more about depression in particular, but we can't do studies on all of them. But we know that people are out there doing cold water swimming as self-medication. So we sent out a survey, and I thought, through the Outdoor Swimming Society, it's a great resource. Check it out if you haven't already. And then sent it out through them to say, are you using cold water swimming to help you physically with illness, whatever? And if so, does it have an effect? And this kind of thing. And I was kind of expecting we get 30 or 40 responses. We got over 700 responses for this.
Wow.
And our theory's always been that it's due to inflammation. You reduce inflammation with cold water swimming. And the theory was therefore that it would be conditions associated with inflammation which people would find benefit for. And indeed, what we got back was most people using it for their mental health, but there was still a significant number who were using it for other conditions, and they were all conditions related to inflammation. And it was actually the reason I got into studying depression and cold water swimming was because I read an article in the newspaper, it wasn't even a medical journal, where they talked about how recent research which showed that a lot of depression is related to inflammation. And it turns out it's around 60%. So I thought, well, I feel good. I've been lucky enough not to suffer from, clinical depression, but I know how good I felt when I got out of the water. So that combination made me think, maybe we could use it. Yeah, we could use it for, as a treatment for depression. And that's where the kind of research is coming from, and I've been very lucky with the collaborators I've had, who've also come to this conclusion. And, it's really a massive team effort to get to it. So now we're at the stage where we've done we first did a case report, which was just on television. And then we did a small feasibility trial. We didn't even know if people would turn up, for people with depression and anxiety. We ran some courses. We had no idea whether anyone would come. And if they came the first day, they'd be so put off it, they wouldn't come back. But anyway, that went really well. We've finished now the first stage of a randomized controlled trial on depression, using cold water swimming versus standard therapy for depression. And we've had very good results from that. It's not definitive because it's too small, but that's led now to this year where we've got funding now to run a definitive randomized control trial, which will tell us whether it's a standard treatment, which we're hoping to launch at the end of this week, and will certainly we should be recruiting this year and next year. We need about just under 500 patients for that.
Wow, 500.
Yeah.
That's a nice big study.
It's a nice big study, yeah.
Yeah, congratulations. I mean, we're just starting to work on some studies with the trauma-informed yoga, and it's a lot of work.
It's a lot of work, yeah. And I firmly believe that yoga is great as part of the package. I suppose what you're saying earlier, there's so much, you're quite right, there's so much that we can do for our health and whatever. What I love about cold water swimming is it doesn't have to be very long. It can be it's such a quick process. So it's easy. I mean, it's easy for me because I do it on the way to work. So it really helps. But it's a relatively quick thing that you can be able to do, and it has a big effect. And the studies that we've been doing have been just doing it once a week, and so I'd probably get a bit more benefit from more than once a week. But certainly for depression and anxiety, we know that courses that run once a week are effective.
That's great. That was
Yeah,
going to be one of my questions, is how often.
yeah, and that's it. So we know, again, we don't have definitive trials yet. We should have soon, and all the courses we're running for the definitive trial are once a week. But we've seen really, really good results with just once a week cold water
It
swimming.
just seems like so many issues of the body mind system have to do with inflammation that if you could figure out that cold water swimming helps with inflammation, you're almost covering such a wide range.
Well, that's kind of where we came from in the first place, because the physiological studies had shown that it does have this effect on inflammation. It's very difficult to tease it out, and we could have gone down the route of saying, oh, is it, do we see improvements in patients with inflammation, and does their inflammation track their symptoms? But really, that's quite complicated stuff, which would require tens of thousands of patients. So my thing was always to see, right, does it work? Do people want to do it, and does it work?
Yeah.
And then later on we can come to it. But the theory, the physiological theories that came or that gave the idea for this was that, it has an effect on inflammation and it can reduce inflammation. Therefore, let's have a look at that.
Yeah. I mean, 500 alone, I mean, that's a good number. And I know, the more you have, the more a study like this will be, considered you had a good group, right? A good sample group. Is that half of them will be cold water swimming and the other half will be control or on a wait
Yes,
list? Yeah.
yes. I mean, one of my colleagues came up with this idea, which I think is genius. Is that so that half of them will go through will go the cold water swimming, and the other half will get standard therapy. But at the
Mm-hmm.
end of the ones who are doing standard therapy, at the end of the study, they will be given a cold water swimming course. So they will get
Yeah.
to it in the end,
Yeah.
and that's really nice. It gives them that thing to look forward to. They're not going to miss out on it.
Well, we're gonna have you back on after you get these results to talk about it. I've gotten so into studies and how they're run. We had on Dave Emerson, who's really big in the trauma informed yoga studies world, and we're working on one, and it's just so interesting. And I think the fact that that this control group is getting therapy is going to be super interesting, right?
Yeah, it is. It's going to be a fascinating study. I mean, it's quite funny. So the first woman, I said that where we first did this was for a TV program called The Doctor Who Gave Up Drugs, and I just met Professor Mike Tipton a few weeks before, and he's the professor of extreme physiology, and he was the one who'd done all these studies. And so he was asked by this TV doctor, Chris Van Tulleken, who's actually been promoting his book, Ultra Processed People, in the US quite recently, I think. Anyway, he was asked by him, if you got anything I can use cold water swimming for? And he said, I've just met this guy who has this theory you can use it for depression. So anyway, we went off and it was all very good. But at one point, I said to Chris, what happens if this doesn't work? My whole theory, the whole theory is completely destroyed. He said, "Don't worry, it always works on television." And so that was good. But that's kind of where you're starting from, and it takes a lot to sort of move on from that to get to the more definitive evidence.
Yeah, I mean, just to get that kind of, the enrollment and set up the study, in a way that's really valid, and make sure people are really doing what they say they're doing and all the things. I mean, it's quite a big endeavor, but it's very exciting, and that's how we learn more, right? I mean, it's great to, N of one, share our own experiences and how much it's helped us, but to really see if it's helping many people and exactly for which thing, so that we can recommend yoga for this and cold plunge for this, and get a little more specific.
Yeah, and I think, and this is it, one of the things that we've got might be quite interesting. I don't know what you're doing about this as a yoga study. So one of the things, a really big part, I mean, just as big a part of that is, okay, we need the numbers because,
Yeah.
governments and whatever, they're only interested in numbers, and doctors are only really interested in numbers on the whole. But I think that's really missing the point. So just a bigger part of our studies is the qualitative side of it.
Yes.
So, to get people's experiences, and this is it, you mentioned the book, and I love the stories. I take no credit for the stories. I just know these people, and it's been great, and hearing their stories, and it's the stories which really engage people, I think. Okay, governments will fund it with the numbers, but if you want people to come and actually do the activity or whatever, it's the stories of how it's benefited them, and where they've been, and their life story really is
Yeah.
much more interesting than any numbers that we can come up with.
Well, the stories are so good, and I think, there are a lot of really good stories in there that different people could relate to, folks feeling like I've tried everything, right? I've tried the meds, I've tried different therapies. If this is something that you haven't tried, give it a try.
Yeah, that's it. And the thing is, what are the side effects? As long as you don't stay in too long, become hypothermic. What are the side effects of going into cold water or swimming in the ocean or whatever? You're just getting a bit of exercise, or you're just being outside. These are good side effects.
Such a good point. Such a good point. Like, what's the risk is low, right? The side effects of some of these medications are pretty extreme.
Yeah, absolutely. I mean, interesting. So Sarah is the woman we did the TV program with. She wanted to, what her real motivation was that, she had a baby daughter. She was a single mum. She had a baby daughter. She was been taking these pills for 8 years. She didn't want to see her baby daughter grow up to see her mum just taking pills to control, her mental health. And that's what motivated her to go on TV and have a go at this. And it's fantastic that it's probably about a year ago now since I last had contact with her. But that was 6 years after we'd done the program, and she was still using cold water swimming as a way to deal with her, control her mood and mental health.
There's one more element I want to mention that's in your book, and then I want to ask you. You shared a little bit about what's coming up next for you, but maybe some other things you're involved in and how people can stay abreast of your work. You also do talk about cold water therapy for pain.
Yeah. So see, this is an interesting one. Again, pain highly related to inflammation, and I also think it's getting out of your head.
Yeah.
I think has got to help it. But the guy I write about in the book with chronic pain, a guy called Grant, what I think is really interesting, and this is a common theme amongst the people who are involved, the stories I tell, was that he had become depressed, and this is often the way with chronic pain. You become isolated, you can't do normal things, and his comment was, chronic pain is a lonely place.
Mm-hmm.
And he was just about to get his family doctor to refer him in for specialist treatment when he saw that people, he read about our study or whatever. This is the second phase when we're just sort of seeing, well, this are people want to turn up and come along and do these courses. And he read about it. It was near where he lived in South England. And he said, okay, look, I'll give this a go. Let's just give this a go before I go in. And he went in for his depression. And then he noticed, coincidentally, that his chronic pain, his pain was getting better. And again, it's not gone away, but it's taken him from a level where it really affected his daily life to one where he can function much, much better.
Chronic pain is really, it's just devastating. It causes people so much isolation. Life becomes more limiting, unlimited, and it's often very hard to figure out, where the pain is coming from and what to do. I had Dr. Christiana Wolf on the podcast, and we talked about She does a lot of work with pain and mindfulness. I mean, it's too much to recap here, but the body sends a signal of pain often as a warning, or it thinks that it's going to get hurt, or it thinks that, something could be wrong. So, of course, if you have pain, you have to get checked out physically, but often it's a kind of signal loop.
Yeah, exactly. It's just a loop. And this is, it's an electrical loop that keeps going round and round and round. And I think this is one of the things you get from getting in the cold water. It just takes that all away. You break those loops.
Yeah.
Again, that's that shift from the left to the right hand side of the brain. I know it's that aspect of it, but those loops are all broken, whether they're mental loops, physical loops. And of course, again, I'm not taking anything away from it in any way at all, but pain is all in the brain. It's not, it's not pain there's no pain in your arm or leg or whatever. It's in the brain. So it's how the brain deals with it. And of course, sometimes it needs to deal with it, but you get these loops and which you need to take something out of those electrical patterns and the way the brain is dealing with those loops and those signals. And that's where I think cold water swimming really helps for those people with this awful, debilitating condition of chronic pain.
Yeah, so well said. I mean, the pain is real, and it doesn't diminish that to talk about, that it's in the brain. That doesn't make it less real. So
yeah, no, not at all. And this is it. It's like the fight or flight response. It can be exciting, it could be scary. It's a matter of how we interpret it, and sometimes these interpretations are really, there's these loops, there's these stuck electrical circuits you just can't get out, and you need to find some way of breaking those electrical circuits.
Shock the system.
Yeah, exactly so.
Yeah. Well, Mark, this has been just fabulous. I mean, this is such a personal area of interest of mine. So I only bring people on that I'm really interested in, but I have to say this is something that I'm just so into right now. Things I didn't ask you, anything I didn't ask you that you want to share with the audience?
I don't think so. Yeah, I think we've had a really good coverage in a really nice way of all the different aspects of cold water swimming and how it's beneficial, how it's not. I suppose one thing to say is, you mentioned your saunas as well. I mean, I always think I know it's really important to go into the water warm. And, the best way is to warm up through exercise because you warm from the inside out.
Yes.
So that's a good way of doing it. But, when you're totally warmed through, like in a sauna, then that's good because your body, it stops you from becoming hypothermic. Your body has this massive store of heat. You can give up a load of that heat to the water, and you can have your cold water hit and get back in without it having the negative effect of becoming hypothermic. So I'm a big fan of doing the sauna thing as well. And interestingly, sauna, heat therapy has similar effects, or heat stress has similar effects to cold stress, but it's much more difficult to generate that kind of heat that becomes so stressful than it is to just get in cold water when the cold water just needs to be 68 Fahrenheit.
Yeah. Oh, that's interesting. Yeah, that was one of the things I was worried about with doing my first, natural water swimming was I was also a first of not having the sauna right 2 feet away to jump back into. So I made sure, and you do a great job in your book, which folks should get, and we'll shout out some recommendations for getting warm after. I do find even with sauna that the night after I've done some cold plunging that, my body will be a little bit chilled. So I just have to wear some extra socks, drink some tea and those things.
Yeah. Yeah. And that's it. Keep him warm. If you're warm before you go in, and get out and get warm afterwards. It's really important. We just want to expose ourselves to that cold, expose ourselves to that stress. We'll feel good for it. We don't want to actually get our bodies cold. So anything we can do to improve that is a good thing.
You said about 2-3 minutes, about once a week. And one more thing I wanted to clarify with you: do we need to dunk our head under, our face?
Okay, so the body is the sympathetic, it's reducing that sympathetic drive, so reducing the fight flight to more manageable, good levels. What you get if you put your face, doesn't have to be the whole head, absolutely not the whole head. I mean, I always wear a hat, most people wear a hat when they go in the really cold water. It's the face. So if you put your face in, you'll get an additional effect.
Okay.
So that's where you stimulate the parasympathetic nervous system. So that's the other side to reducing stress. More parasympathetic, less sympathetic.
Okay, that gives you both.
Again, yeah. And so you get an increased effect from that. So it's good if you can do it. Doesn't matter if you don't do it, you're still winning. But again, like with the cold, you don't just put your head straight in and straight out. That's not doing it. But you just need to put it in long enough that you recombobulate. So, you put your face in 2-3 seconds and that initial shock's over, and then bring it out again and do that. I say 3 times. I think that's probably about right. So I say like 3 minutes, 3 times with your face in the water. You've done all you need to do. You're not going to get any massive benefit from anything more. Of course, the weather's nice, it's warm, go for a swim, stay in a bit longer. But when it's really cold, I'm guessing, sometimes I'm not even in 3 minutes, I was thought.
Yeah. Yeah, I didn't do the whole 3 minutes on my first one in the lake, but I figured be gentle myself and work my way up to it like I did with the tub, and all will come in time.
Yeah, that's it. And work your way up to it. And really, I say, not that long, not that cold, not that often.
I love that. I love that. The warnings are so important. We want to do this safely. And I love that you remind us of that. Mark, tell people the name of your book and where they can follow your work and find you.
So the name of my book is Chill, the Cold Water Swim Cure, available everywhere, I think. And I don't really do much social media or anything. I do Instagram, which is @thewildswimdoctor. And I sort of post interesting things I come across, just swimming related or outdoor swimming related stuff. I also have a website, which is drmarkharper.com, where people can contact me if they want. I'm always happy to talk to people and listen, hear their stories, and give advice if that's what they want.
Oh, that's so great. Well, thank you. This has been quite a joy, and I will be following you on the Instagram and news of your new study. Thank you so much.
Yeah, well, thank you. It's been a real pleasure.
As we buzz around the busy world, it becomes clear there are billions of paths. As we buzz around the busy world, we will appear in other people's photographs. As we speed through the centuries, we will collide and the light will bend. We will be accidentally immortalized in someone else's land.